بسم الله الرحمن الرحيم. Public health. The objective of our presentation is to define the public health, to define public health administration, to determine the element of administration, to define the plan for administration. Before making a definition for public health administration, we need to take idea about the objective of healthcare and the objective of healthcare organization. The objective of healthcare organization start by highest level of care, which is health promotion, which is the state of maintenance and improvement of health and the quality of life beside elongation of life. The second objective is prevention. Usually the prevention make for risky people, while the health promotion for non-risky people. The third objective, early detection and management, and the fourth one is rehabilitation. And so when we make definition of public health, we would like to know that the public health takes the highest level of health objective, which is the science and the art of maintaining and protecting and improving the health of people through the organized community effort. This is very important. Public health administration is a number of activity and effort to achieve the health service goal. This is very important in the cost efficient and cost effective manner. The element of primary health care administration is the planning, implementation, and evaluation. The definition of planning is a predetermined course of action. Predetermined course of action. This is called the planning. The requirement of the planning process need a good intellectual activity and the intellectual function of the planners in the form of broad level of knowledge, in the form of past experience in the field, in foresight, and the spatial skill. This is criteria is needed to help the planner for diagnosis of community health problem and to evaluate the resource needed to fight the community health problem. The planner need to know the characteristic of such a problem, nature, magnitude, pattern of spread, complication, and sequelae of that disease, and to establish the priority of that problem. The establishing priorities of that problem need to know what is the element which is needed to define the priority. First of all, the acuity and the severity of disease. This can be take the score from 1 to 4. Mild 1, moderate 2, severe 3, and high severe takes the score 4. Also depend on the morbidity and mortality, like the prevalence and the incidence of disease, like the mortality rates. And so mortality rates and the prevalence and the incidence less than 10 take score 1, less than from 10 to 20, less than 20 take score 2, from 20 to less than 30 score 3, from 30 and above take score 4. Also the characteristic of involved group as regarding the diarrheal disease usually affects the child less than 5 years of life. Sequelae of disease, and so when the disease leads to a lot of complication takes the score 4, and mild complication score 1, and so on. Also the feasibility of the solution. Feasibility meaning the easiness of the solution regarding the availability of the human and non-human resource, the expertise which can read the investigation. This is very important. The kits for investigation, the X-ray for investigation, the MRI for investigation. And so if the feasibility is available, take score high feasibility, score 4, and low feasibility, take score 1. Program applicability to the certain catchment group, resource of community, the scope cover a large number of people, and urgency as emergency condition. Problem solving requirements. First of all, we need to define the aim which is meaning the general direction of our study. Goal mean the final purpose. Objective mean what can be reached or achieved or point of success. This is very important. And so the objective is the predetermined course of action on the plan. This is very important. And we should know that the objective should be achieved. This is called the internal validity of our project. Determine the required activity, determine the required resource to perform such activity, acceptability of the healthcare provider and the healthcare consumer, very important. Implementation, the implementation is divided into two parts or two elements. The first one is called the putting the function structure unit. This is function structure unit divided into central level, peripheral level, and the intermediate level. The responsibility of the central level to put the strategy, to make the protocol of action. This is very important, and to supervise the implementation and make the evaluation and improvement, beside support the peripheral level by the resource, human and non-human resource. While the peripheral level is executive health service, which including the physician, paramedical, which including nurse, and also the technician. This is the peripheral level. While the intermediate level, it is linked between the central and the peripheral. Take the instruction from the central and pass to the peripheral, and take the need of the peripheral and passes to the central one. Organization, this is very important. The organization is interpretation of the plan health program into service. يعني بحول الخطة إلى عملي على أرض الواقع. أول جزئية في الأورجنايزيشن meaning the departmentation. بعمل عيادة لأمراض الحساسية، بعملها في الرعاية الصحية الأولية، فأنا هاخد أوضة، فالأوضة دي ده departmentation، بقسمها يعني. يبقى الديبارتمنت دي هتبقى خاصة بتخصص الحساسية. يبقى ده بنسميها الأزمة clinics. After that, we mention on the door of the room specialization. This is room is for the specialty of allergy. This is very important. Specialization or for the asthma clinics. This is very important. The person inside that room takes the decision by himself or by the others. Centralization and decentralization. هو في disease أنا لازم آخد رأي القيادة العليا في إن أعالجه ولا لأ؟ أيوة طبعا. يعني في حالات الكارنتينابل disease like cholera, we have to take the instruction from the central level before making any action. This is very important. After that, we need to make staffing for that clinics and the pre-service training course. Give them an instruction which is called the direction. There are two types of direction, consultative direction and non-consultative direction. After that, we would like to make cooperation, coordination, and collaboration. Cooperation between all the staff in the same specialty, in the same department. This is very important. But the coordination between the different specialty, like the public health and the pediatric department regarding the vaccine and prevention of disease. This is very important. Collaboration, this is the cooperation between the organization and the other organization, health or health-related organization. After that, we need to making the budget. After that, the result of our program should be reported to the central level and to the local and the general health authority. Very important to know. Evaluation, it is the comparison process, usually between our activity and our results and the international standard. And so we can compare ourselves by international standard or national standard, which it is called the level of acceptability, or the benchmark. This is organization well known as the best practice in the field. And so Harvard is the best medical college all over the world. We can compare ourselves by Harvard. Harvard is not the international standard, but it is called the benchmark. or we can compare our activity and our result by the past experiences. This is very important. Type of evaluation, we make usually the evaluation before planning of the health problem. First, by need assessment analysis. Need assessment analysis or relevance evaluation, because the problem facing our community or relevant to our community. Or maybe evaluation during the planning through the assessment of human and non-human resource. Human and non-human resource. This is very important. This is called the input evaluation or the structure evaluation. Or maybe during the coverage evaluation, because we are planned to cover all the pediatric age group less than 5 for vaccination. And so this is the coverage. This is very important. After that, the process evaluation. During the application of a certain program like diagnosis and treatment of bronchial asthma or asthma clinics, how we can diagnose our patient, how we can making the service and investigate for the asthmatic patients. This is very important. This is called the progress or the process evaluation. At the end of the program, we can evaluate through the output evaluation, outcome evaluation, impact evaluation, and efficiency evaluation. Output just including the number subjected to the treatment for bronchial asthma, for example. And so we have about 100 persons treated from bronchial asthma. But in the output, we cannot mention the result. While the outcome, we can mention the result. The outcome is also meaning the effectiveness evaluation. Usually it is measured by CAP meaning knowledge, attitude, and the practice of the healthcare provider and the healthcare consumer or patient. This is very important. Impact evaluation, usually the long-term outcome. And so it is reflected on the indices of morbidity and mortality, like the number of prevalence of the bronchial asthma will be decrease or increase, or the mortality rate from bronchial asthma increase or decrease. After that, the efficiency evaluation. Efficiency evaluation usually relates the cost to the result. And so it is measured by the unit price. What's the meaning of measure of unit price? يعني أنا بقدم خدمات صحية لعدد من الناس بفلوس معينة. قدرت أقلل عدد الوفيات بنسبة 10%، الكوست بتاعهم كان مليون جنيه. يبقى ال 10% اليونت برايس، ال 1% بنقسم المليون على ال 10 فيطلع لي ان تكلفة ال 1% 100,000 جنيه. لو نفس البرنامج ده اتعمل في اي دولة تانية وكانت تقليل نسبة الوفيات 5% بس دفعت عليهم 10,000 جنيه، معناها ان ال 1% بيساوي 2000. يبقى اللي دفع 2000 هو جاب تقليل نسبة الوفيات ب 2000 جنيه، بالمقارنة بالتاني جاب نسبة تقليل الوفيات باي 1% ب 100,000 جنيه. يبقى مين efficient؟ أكيد الأقل كوست. يبقى ده مهم قوي. يبقى ال efficiency evaluation relates the cost to the result. Method of data collection for evaluation. Maybe first studies the administrative system of the work, hour of the work, flow of the work، كم علبة دواء اتاخدت، كم كشفنا على كم عيان، كم عيان خد العلاج. يبقى ده مهم جدا، ده بنسميها ال study of administrative system of the work. Or maybe utilization of the health service. And so the maternal health care utilization is equal to 20%, meaning that only 20% of pregnant women receive the antenatal care or something like that. The attitude of the health team, this is very important, or collection of vital indices from the morbidity and mortality indices, survey study, record, report, rating, rapid rural appraisal, stock taking. What's the meaning of rapid rural appraisal? If you would like to take idea about the disease most prevail in a certain area, we have to take the opinion of the physician, and so give the paper for every physician. He mentions the most important disease facing him every day. By that method, it is called the rapid appraisal. Rapid appraisal. Stock taking, meaning the amount of the drug taken from the pharmacy. This is very important. And so we take about 100,000 antibiotics drugs, 100 drug for the antithyroid, and so on, so on. Another, which it is called the time and motion study. Time and motion, meaning that the drugs is taken from the pharmacy within 1 month, within 3 months interval. Sometimes we need the interview, questionnaire, registration, and so on. This is the method of evaluation. Thank you very much.